Okay, good afternoon, everyone. We are now at just about 70 people and counting, but in respect of everyone's time and in recognition of the fact that we've got quite a full agenda, I'd like to get started. So good afternoon, everyone. For those that I haven't had the pleasure of meeting yet, my name is Tim Rutledge, and I have the honor and privilege of being the president and CEO of Unity Health Toronto. And for those that may not know, Unity Health Toronto consists of St. Joe's Health Centre in the west part of Toronto, St. Michael's Hospital downtown, and Providence Healthcare in the east. And we have, I believe, 12 satellite centers, which includes family health teams, mental health services, dialysis clinics, and other. Unity Health has had the honor of being together now for about 4 years, and we've had this name Unity Health, for 3 years. Many thanks to all of you for joining us for our inaugural community town hall. We've actually been discussing holding an annual open board meeting in this town hall format for some time now, but with all the activities related to the pandemic, it's taken until now to make this happen. Going forward, we'd like to make this an annual event. Very pleased to have joining us today members of the Unity Health Board of Directors, many of our staff, physicians, and volunteers. And we'd like to extend a very special welcome to all of our guests, including our patient and family partners, community partners, members of the Ontario Health Toronto Region team, and members of our wonderful foundations. Once again, thank you all for joining us. It's great to see so many of you. Today is the eve of a new federal statutory holiday, the National Day for Truth and Reconciliation. So I'd like to take a moment to reflect on the significant harms committed against Indigenous peoples and the many ongoing inequities that continue to exist today. We are committed to creating a formal land acknowledgement with Indigenous partners, a process that will take some time. Until then, we remain committed to acknowledging the land that we live and work on. So as we gather today, we acknowledge this land, the people, and all other beings, animate and inanimate, those on this land now, as well as the ancestors. This area has been a place of communities coming together for well over 15,000 years. This land has been the territory of the Huron-Wendat and the Petun Nations, the Seneca, and most recently, the Mississaugas of the Credit First Nation. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to live and work in this land. We are also mindful of the broken covenants and the need to strive to make right with all our relations, sharing stories and telling the truth of this place. So thank you for reflecting with me on this. This year has truly been unlike any other. The demands personally and professionally have tested us all. It has also tested our health system, and unfortunately, with wave 4 upon us, COVID-19 is not over yet. This past year, we have seen incredible resilience, and many of us have seen numerous inspiring things happen over the course of this pandemic. Incredible acts of kindness and compassion from our neighbors and our community, innovation moving as fast and sometimes faster than this virus, and most of all, partnerships that we have formed or strengthened in our united effort to care for those who have needed us the most. This afternoon, we'd like to celebrate some of those accomplishments that we've achieved together with our partners. And we'd like to express our gratitude for the collective contributions that enabled all of us as a system to step up and respond during this unprecedented time. We'd also like to look forward into the future and share our plans to deliver the best possible care experiences together. We also plan to have some time to hear feedback or answer questions that you may have. So let's get started. And we'd like to start with an opening reflection by Donna Romano from our Mission and Spiritual Care team. Over to you, Donna.
Thanks, Tim. Good afternoon, everyone. For today's mission moment at our virtual open town hall, I will be reflecting on the Feast of St. Michael, which falls on today's date and is recognized across the world. Our mission team often gets asked, what is a feast day? And how many are curious about who St. Michael is? To begin, a feast day is a day of celebration, which we extend in recognizing with gratitude all of the amazing work that our people do across our sites. Regarding St. Michael, he is known in Christianity as one of the archangels, or head angel, and he is also referenced in the world's religions of Judaism and Islam. The word angel is translated from a Hebrew word that literally means messenger. St. Michael is designated as the protector of those who strive to preserve security, safety, and peace. He is also the patron saint of people who are sick and suffering from any type of illness. Now, all this is very fitting, given that our St. Michael site was named after him by our founders, the Sisters of St. Joseph, Toronto. Now, on a personal note, he can be seen almost as a celebrity, whereby patients and families will come by my office at St. Michael's asking where they can find his infamous statue. Of note, his image is portrayed above the outside door of our historical 30 bond, which you can see on the slide here. His headshots are throughout our site, and within the Bond Street entrance, many will visit his statue, leaving flowers and notes of gratitude for healing, which is also depicted on the slide. So on this day of recognition, like St. Michael, thank you. Thank you to all of you for being messengers of hope, strength, healing, and light for all those that we serve within the walls of our sites, our community, and with our community partners. Happy St. Michael's Feast Day, everyone. Back over to you, Tim.
Thank you, Donna. We are very fortunate at Unity Health to have an outstanding board of directors who consistently add value to our organization. They provide tremendous insight, guidance, and support to me, our executive team, and many others across Unity Health. While always valuable, this has been especially appreciated this past year. And it is now my pleasure to introduce the chair of the board of directors of Unity Health Toronto, Colleen Johnston.
Well, good afternoon, everyone, and thank you for joining us today. And thank you, Tim, and thank you, Donna, for reminding us that all we do is embedded in compassion and gratitude. I'm excited to welcome all of you to our inaugural open board meeting. Governance of the organization is a role we take seriously, and we draw on the strengths and diversity of all our backgrounds to support Unity Health Toronto. Each and every one of us are fully devoted to this organization. On behalf of the board, I want to start by recognizing these challenging times and extend a sincere and heartfelt thank you to all the staff and partners for all the work that you do each and every day. Our board is very proud of all who work at Unity Health Toronto, providing excellent, compassionate care to our patients, especially our frontline healthcare workers. This has been so true during this terrible pandemic. I'd like to acknowledge the role of our foundations. We are incredibly grateful for their contributions and recognize that many of the things that Unity Health has achieved would not be possible without their support. To provide some insights into what the board does, we provide oversight and governance around the operation of our hospitals, but also on the strategy, moving us forward on important topics such as Unity Health Toronto's growing digital landscape, healthcare funding, and equitable access to integrated healthcare. Let me select a few highlights of the board work over the past year. One was refinement of our 2024 strategic goals, including adding anti-racism, equity, and social accountability as a goal, and evolution of Unity Health's equity, diversity, and inclusivity work. Development and approval of the research strategic plan. This ensures that we will be the world-class leader in research and innovation. This will be our compass for the next 5 years. We approved the business case for a new electronic patient record. This will be the digital foundation to improve the patient experience, drive clinical transformation, and harness the power of information with advanced analytics. Also, approval of 3 new Ontario Health Team applications. including downtown East Toronto, West Toronto, and Scarborough. These partnerships proved instrumental in our crisis management during COVID and for COVID-19 vaccination efforts. We are now in the process of recruiting new board members and making a special effort to have Indigenous representation. To all of our staff and partners, we couldn't have done this without you. You have our deepest thanks. We look forward to the future and promise of Unity Health Toronto as we continue to progress. With that, I'll hand it back to Tim.
Thanks very much, Colleen. Really pleased to see we have over 100 people with us now and counting. And as I mentioned earlier, we really do want to express our gratitude today to all of those who've been part of our success this past year. It truly has taken a village to achieve all that we have. We did have some thank you slides rolling as people were joining us at the beginning of the meeting. I hope you had a chance to see those. And just want to emphasize that we really couldn't have accomplished all that we have without the support of many of you. Of course, the list is too many to be completely inclusive, but I do want to highlight that you know, our success is to a large extent due to our staff and our physicians, our healthcare heroes, our community partners, many of whom joined us who have joined us this afternoon, who work with us to deliver the best care experiences. Our Ontario Health and Ministry of Health partners, Toronto Public Health, our foundations, as Colleen mentioned, who provided so much support to our staff and physicians and to the services we provide, and to our education and research activities. And our Unity Health Toronto board members, important this past year that they created a COVID-19 support fund and generously distributed wellness kits to all our staff and physicians, and that was hugely appreciated. I'd like to extend a special thanks to two of our board members who recently finished their terms with us. They are Virginia West and Joe Calderon. Virginia and Joe, many thanks for your valuable contributions over the years. It has indeed been an eventful year. As you will all know, much of our attention has been focused on getting through the pandemic. Alongside our Ontario Health Team partners in the East, West, and Downtown East and Scarborough regions, we collaborated to provide over 300,000 vaccines to members of the communities that we serve, healthcare workers, and we had special efforts going in to reaching out to those most in need. We also contributed to vaccinating people living in remote communities in Northern Ontario. We supported 17 long-term care and retirement homes, providing improvements in safety, quality, and infection and prevention control through the pandemic. We opened a COVID rehabilitation unit at our Providence site, which was the first rehab facility to do this. And that facility has served over 160 patients so far. We hit the ground running with virtual care appointments, and I want to extend a special thank you to our tremendous IT teams for their work in supporting this. Our education folks provided incredibly important simulation training for many of our staff, with proper use of PPE and simulations of resuscitations in high-risk situations. And our research teams pivoted to do important COVID-19 research, including how the virus has impacted populations, particularly those that have been marginalized. They've studied the pathophysiological mechanisms of COVID infections and how they can reveal new ways to treat the virus as well as future pandemics. And they've been investigating which existing medications can be useful in treating COVID. Also, very pleased that during the pandemic, our research team developed and launched their exciting new strategic plan. So along with all this COVID work, I'm pleased to let you know that we've also been able to with your support, make significant gains on what we set out to do, our strategic plan. We're about halfway through our 5-year strategic plan at Unity Health, which we remain committed to and inspired by. We worked with our board of directors to capture this aspirational strategy into a high-level set of, excuse the background announcement. We captured this in some high-level overarching goals. And these goals draw on all the components of the strategy illustrated here. So it's an integrated strategy, and these goals capture what we're trying to accomplish with these components. The foundation of our strategy isn't on this particular slide, but I do want to highlight that the foundation of our strategy is our mission and values, and they will always guide our work. They are our why and how. Our vision statement, which is the overarching aspiration, ties this all together. It is the what of our strategy, and it is here in bold, the best care experiences created together. Created together is a really important component of that statement for a number of reasons. Among them is the recognition that we can't achieve our goals without really great partnerships with our patients and their families and our community partners. And so we're very committed to working together to provide the best possible holistic care experiences to all in need. Equity, diversity, and inclusion have been a part of our plan since the beginning. However, events over the past 2 years have highlighted the importance of making this a very focused priority. Recognizing the history and ongoing issues of systemic racism, colonialization, and structural inequities in Canada, including how they manifest in healthcare institutions like our own, Unity Health has embarked on a journey of foundational work towards anti-racism, equity, and social accountability. An important first step in that journey was establishing our Council on Anti-Racism, Equity, and Social Accountability. And I just want to point out this is but one step. We now have activities and educational offerings in anti-racism, equity, and social accountability in pretty much every portfolio at Unity Health, and we're just getting started in this important work. I do want to also emphasize that this work will be both internally and externally focused. So that is, Unity Health is committed to addressing equity issues among all those that we serve from very diverse populations. And the focus on equity also extends internally to our people, our staff, physicians, learners, and researchers. We're fully committed to reducing bias and being anti-racist in our workplaces and our learning environments. We're striving to provide welcoming, safe, and healthy workplaces and learning environments. This is a really important part of the spectrum of work that we're doing to help everyone at Unity Health to find joy in their work. We know that the strength of Unity Health is our people, and our people strategy aims to address wellness and to help our people to achieve their full potential. We're also pleased to have made a lot of progress with our work in data science and advanced analytics, or artificial intelligence. In this, we're finding applied solutions to improve healthcare outcomes. As an example, we've harnessed artificial intelligence to develop a tracking tool in the emergency department that centralizes data on patients experiencing homelessness to help identify COVID-19 outbreaks in shelters. And we have goals designed to challenge us to become world leaders in a number of areas, in research and innovation, in certain specialty areas, including multiple sclerosis, trauma, critical care, and innovative procedures for diseases of the brain and heart. The pandemic has ushered in a new era when it comes to virtual care, and we will continue to improve the infrastructure needed to deliver high-quality digital health. We're preparing for a new electronic patient record, a multi-year project that will create a seamless exchange of information and will benefit Unity Health, our partner healthcare providers, the health system, and most importantly, our patients as they move across all of these settings. We can't provide world-class care without world-class facilities. So we're working on significant space and technological upgrades at all of our sites, adding long-term care beds at Providence Healthcare, the creation of a new patient tower at St. Joe's Health Center, and continuing with the St. Michael's development, which will bring a new shooter wing and the expansion of the St. Mike's Emergency Department. So this was a very quick overview of some of the features of our strategic plan, and I hope it gives you a sense of what we've been up to this past year. I think you'll agree it's been quite a year, quite a productive year. And I'll just wind down with an acknowledgement that it has been a challenging year with considerable expenses related to COVID. As a public hospital, we have a responsibility to our taxpayers to manage our finances. And I'm pleased to share that we were able to balance our budget, and we will use any excess revenue over expenses to reinvest in our capital needs. So I'll close by reiterating our heartfelt gratitude to all of our partners. Our vision of the best care experiences created together is made possible by the power of partnerships inside and outside of our walls, and our collective efforts to put patients at the center of everything we do. And now I'm pleased to introduce one of our patients, Debbie Crowder. Debbie was one of the first participants of the bariatric surgery orientation through Providence in September of 2019 and had her surgery in January of 2020 at St. Joe's. Debbie, thank you so much for joining us, and thank you for speaking tonight. And so with that, I'd like to hand it over to you.
Oh, thank you very much, Tim. Good afternoon. My name is Debbie Crowder, and it is truly humbling that I was selected to speak today at this event. I'm a former patient of Unity Health, and I am currently a patient family partner involved with the Bariatric Team of Excellence, where I co-facilitated implementing the first bariatric surgery support group. I am also involved in projects related to long-term care space design, falls prevention, virtual care, health literacy, and accreditation. My connection with Unity Health has been lifelong. On December 22nd, 1926, my mom was born at St. Joseph's. Fast forward 94 years later, and I would find myself walking into St. Joseph's in the early morning hours for surgery, feeling like I was home again, that I was in a safe place, surrounded by caring, compassionate people who strive for the values put in place at Unity: community, excellence, compassion, human dignity, and inclusivity. My journey with bariatric surgery began in 2019 with an initial 3-month orientation period, which took place at Providence Healthcare. I was part of the first group of patients entering their program. We were a very diverse group from many different sectors of the community. The orientation team were compassionate and made everyone in the room feel welcomed and safe. Members of Providence Healthcare's Bariatric Team of Excellence were present at the numerous sessions we were required to attend. Administrative staff were efficient and compassionate, understanding our needs. They helped us schedule the complex appointments we would need over the coming months and made sure that each worked well with our schedules. Written materials were distributed at the onset of the orientation sessions, and they were concise and informative. The team were willing to answer our concerns and questions with compassion, understanding, and dignity. My surgery at St. Joseph's would follow in 2020. It went better than I could have ever imagined, and my recuperation was fast and easy. My first post-op appointment was held in person at Providence Healthcare 1 week later. Who knew that would be the last time that I would ever see my healthcare team members in person? With the immediate implementation of pandemic measures put in place at healthcare facilities, my subsequent follow-up appointments had to pivot from in-person to virtual in a blink of an eye. I embraced the idea, and I realized from the onset that I was in good hands with members of my healthcare team. For those who may not know, bariatric surgery involves many different disciplines of healthcare, including but not limited to dietary, social work, internists, surgeons, and nursing, as well as skilled administrative staff. It is a complex and often daunting journey, which would be difficult for some to navigate without the dedication of the expert team like the one that I had at Unity Health. The added complication of having to switch so quickly to virtual care would be enough to throw anybody into a panic situation. But somehow, despite the constant, ever-evolving changes in our world, my appointments transitioned from in-person to virtual flawlessly. I never once felt that my care was in jeopardy, considering that this new virtual world was not only new to me as a patient, but also new to healthcare. I was truly thankful and extremely blessed that my care team at Unity had my best interests at heart and did everything possible to make me feel safe and that I mattered. But my journey is not only about my surgery alone. I have also been involved with other aspects of care at Unity Health. My dad spent the last 11 months of his life in long-term care. I advocated for him when he could no longer do so as his vascular dementia advanced. I immediately became involved with the Friends and Family Council at his long-term care home. Because of that experience, I'm now involved with Providence Healthcare's long-term care space design group, looking at the construction of their new facility. I also found a calling when I embraced the new world of virtual healthcare. I have several members of my family and several close friends who have a hesitance and a fear of virtual healthcare. I work with them to help alleviate their fears and assist in any way possible to ensure that they feel more at ease when they have the need to access a new virtual healthcare world. And now, because of this passion, I currently work as a patient family partner, helping with its implementation across the Unity Healthcare network. Having faced adversity in my own life, it has given me the strength and the ability to reach out and help those in need. Throughout my involvement, both as a former patient and now in my roles as a patient family partner, I have a sense of inclusiveness with Unity Health and know too that I can make a difference in this ever-changing world that we live in. Thank you from the bottom of my heart for providing me this opportunity to share my story today.
Well, Debbie, thank you from all of us for sharing that story. It's wonderful to hear of your experience, and I just want to highlight to everyone here with us this afternoon that the patient voice is so important, and we want to hear the good stories and we want to hear the difficulties people encounter as well, because we know that we can learn from you. And I think probably you've got examples, Debbie, where you've seen us learn from opportunities, and we want to continue to make improvements. The voice of our patients and families is so incredibly important. So, folks, that is what we wanted to present today. And the good news is we have about a half an hour for questions and answers. So that's great. We were concerned that we were going to be tight, and I'm sure some of these questions will take some time as well. But I'm going to endeavor to get into these questions. We had a number that have been pre-submitted, and the good news is we're also getting some submitted online. But I did want to point out that you, all of you in the audience, have the ability to submit questions through the Q&A function on Zoom. Now, you'll see that there's a button at the bottom of your Zoom panel that's Q&A, and you can just push that and enter your question, and we will do our very best to get to as many of those questions as possible, as well as the pre-submitted questions. Now, I will assure you that if we aren't able to get to all the questions, please send your questions to communications@unityhealth.to, and we can follow up with you directly. So that's communications@unityhealth.to. So I'm going to start with some pre-submitted questions. There's one here that's a big question that I'm going to tackle, but I'm not going to put it first because I've been speaking long enough. I'm going to take that second, and I'm going to continue with that theme of patient and family-centered care and go to the second question that we received. And that is, how is Unity Health promoting understanding of patient and family partners' role at leadership levels and ensuring their participation at decision-making tables? And there's another part of that question: what actions are Unity Health taking, is Unity Health taking to build capacity and engage patient and family partners in the organization's priorities? Great and important questions. And I'm going to ask Kathy O'Neill to start with that, and then ask any members of our team that wish to chime in after Kathy gets us started on that important question. Kathy, over to you.
Great, thank you, Tim, and agree. Great questions, and I'm happy to provide sort of beginning to the answers. So as I think everyone is aware, our vision is to create the best care experiences together. And of course, this highly relies on us partnering with our patient and family partners. And so we do continue to engage and embed patient and family partners in decision-making tables, along with many other activities across Unity. Last year, in fact, we engaged patient and family partners in over 92 unique activities, including decision-making tables. This is accomplished through ongoing promotion of our patient and family partners at leadership tables, information on our intranet sites. Our patient and family partners themselves are significant advocates and help us make these connections. And we also help match patient and family partners through our patient experience team across the 3 sites. Some key decision-making tables, and these certainly aren't all of them, but just a few examples where we do have patient and family partners as members of them, include the Board Quality Committee, the Executive Quality Council, the Electronic Patient Record Steering Committee, the Unity Health Ethics Committee, and our Patient Safety Council. In terms of what we're doing to build capacity and engage patient and family partners in the organizational priorities, we certainly continue to look at how we engage our patient and family partners within these priorities. And those are related to our strategic priorities, which we have spoken about, but also about priorities that pop up throughout the year. And so I wanted to just share 3 quick examples of what this looks like for us today. So first of all, we certainly obviously have a continued focus on the pandemic. And during this entire pandemic, we've been very fortunate to have a group of 9 patient and family partners who came from across all 3 sites to meet with us on a monthly basis. This group was central to providing just-in-time forum to provide input from the patient and family perspective on policies, procedures, and communications and other initiatives impacting patients and families during COVID-19. Another current priority for Unity Health is our preparation for upcoming accreditation in January 2022. And so we have heavily embedded patient and family partners across all 3 sites within the accreditation teams and programs and unit-based teams. We also set up a patient and family partner advisory council specific to accreditation that is acting as a resource to ensure that the voice of patients and families involved and inform the strategies around areas for improvement that we have identified for accreditation. And lastly, one of our significant strategic priorities is about implementing a care experience measurement framework. And so this is going to assist us in proactively obtaining feedback from patients and families so that we can identify further opportunities to improve the overall care experience. This work includes patient and family partners right at the survey development tables, all the way through to our Care Experience Institute Steering Committee that is overseeing this important work. Thanks, Tim.
Thank you, Kathy. That was pretty fulsome answer. Did any member of the team want to add anything to that? Okay, I think in the interest of getting through as many questions as we can, we'll move along. But I think you get a sense that we are definitely on a journey to make patient and family-centered care a major focus here at Unity Health. So I am going to tackle this first question. The challenge will be to do it justice. The question is a huge one, and that is, what have we learned from COVID? And what are we doing to change Unity Health going forward as a result? That's a gigantic question, and so I'll try to do it justice. Could probably speak for an hour on this, but what comes to mind is kind of 3 big lessons, although there are hundreds and hundreds of lessons. First, I think the lesson we learned is that our staff and our physicians are tremendously resilient. This has been a marathon, folks. I'm sure you can appreciate it, and those of you on the line who are healthcare providers will understand that. 18 months is a long time, and our folks continue to provide the best care they can while working long hours and often short-staffed. It has been nothing short of incredibly inspiring. However, we can't take this for granted. And we understand, even before COVID, the importance of focusing on wellness. Certainly, this marathon we've been through has highlighted the importance of continued focus on wellness. And so we actually have a whole host of initiatives focused on the wellness of our people within our people plan. The strength of our organization is clearly our people, and we understand that our people are going to need to recover, and we understand this is going to be challenging, as we seek to also catch up on some of the backlogs. But I do want to highlight that we know the importance of wellness and our strategy around joy and work. Another key theme really is COVID has really highlighted for us the importance of cross-sectoral collaboration. Now, this has been really out of necessity. We couldn't have gotten through this without incredible tables where we've had collaboration across sectors. And there's a ton of examples, our vaccination efforts, our community outreach, the transferring and load balancing of critically ill patients, the many cross-sectoral planning tables that we've had. And I guess the takeaway from this is that we must continue this high degree of collaborating to make our system what it can be to optimize the experience of our patients. And then the other incredibly important lesson was that COVID put into stark relief the inequities that exist in our healthcare system. We all saw very clearly and vividly the gaps that exist and how we all need to focus efforts on addressing inequities in our system and making extra efforts to address the needs of the most vulnerable in our communities. And that's a lot easier said than done. The good news is that many of us are focused on this. There's a lot of work going on at the province and the Ontario Health teams in various regions. It's also an important focus at the University of Toronto, and it's certainly an important focus here. So much work to be done. The good news is that we are focusing on this. So an incredibly important question. There are many, many lessons, but I would say those are the ones that rise to the top of my mind. I'm going to go now to a question on oats. This is the question is what role does the Unity Health Board of Directors play in supporting the work of its 4 Ontario Health Team partners? And maybe I'll ask Jennifer to start, and then Colleen, if you want to add any bits on that, we can do that. So Jennifer, can I start with you?
Sure, thanks, Tim. So our boards have been involved in the progress of the OATS as we've moved along. Regular updates are provided to the board from management. The boards were also responsible for approving the submission of OAT applications and approving the CDMAs, the collaborative decision-making arrangements. And the boards have also participated in some joint board sessions that happened around the OATS as they were developing. It has been the subject of discussion at the board on a number of occasions, and it is a regular part of our annual updates in terms of what's happening out and about in our communities as well. So we've done our best to keep the board informed and seek the board's advice on how we should proceed with our Ontario Health Teams.
Thanks, Jennifer. And I'll just add, we've had a lot of discussion at the board over the last couple of years on the topic of the Ontario Health Teams. And we are really very supportive, very big fans of the concept, and we think they can make a huge difference. But, to Jennifer's point, our role really at the board level is around the governance development and approval of the so-called OATS, which is a short form that we use. And we do get regular updates and opportunities to provide input on the OAT activities through management. So that would sort of encompass our role in the Ontario Health Teams.
Thanks tons, Jennifer and Colleen. Irfan, I'm coming to you with one of the pre-submitted questions, and this one is, what does Unity Health do to ensure that Toronto's Indigenous community is assured of our commitment to truth and reconciliation with culturally appropriate services?
Tim, I was really delighted to see this question. Tim mentioned that tomorrow is the National Day for Truth and Reconciliation, so it's obviously a very timely question. There'll be an email going out from Tim to all of our staff and physicians tomorrow. It'll also be on our website, recognizing the importance of the day and what we are doing as an organization on our own journey of recognizing the truth in our own history and reconciling with First Nations, Inuit, and Métis communities locally and beyond. That email will provide some advice to people about what individual actions they can take themselves here, and also will highlight some actions that we are taking as an organization. One of those actions is, as Colleen mentioned, is that the board has embarked on a special process to recruit an Indigenous individual, at least one individual, to the board of directors. We are, trying to learn as we go and improve what we are doing in a variety of areas, including making Indigenous healing practices more widely available to First Nations, Inuit, and Métis patients. There's an area at St. Michael's that we have identified as a Indigenous sacred space, and we're identifying spaces at Providence at St. Joe's, so that First Nations, Inuit, and Métis patients can have a space to participate in ceremony during the course of their treatment. We will also be hiring a strategic lead role. The posting for that should go out on the website tomorrow. And that role will really lay the foundation for some longer term change in terms of how we approach Indigenous wellness and reconciliation. And we do all of this in partnership with a First Nations, Inuit, and Métis community advisory panel. Over the last few months, we've been meeting with them quite frequently. And so that's how we try, and we certainly have a long way to go in terms of doing better in this area, but that's how we try and provide some assurance to First Nations, Inuit, and Métis communities that we work with, that we are truly committed to truth and reconciliation and health equity. So thanks very much for that question.
Thanks, Irfan. And there are a couple of other pre-submitted questions, but I'm going to actually introduce a couple of questions that we've had in the Q&A section right now, just to stay on this theme. Just to remind you, you can submit questions. We still have, 15 minutes or so you can submit questions by pushing the Q&A button and introducing your question. So I won't name the person who asked the question because I haven't been given permission to do that, but there's a very reasonable, very appropriate question here. That is, how come there's no closed captioning or sign interpreter for people that are hard of hearing or deaf? Many thanks for that question. We're going to have to take that as a learning. We did not think about that ahead, and for that I truly apologize. And so we absolutely want to make sure that we're aware of persons with disabilities like hearing impairment. And so please forgive us for today, and we will take that under advisement and work on that for similar sessions in the future. And then there's a question, can we expand on the educational activities on anti-racism and inclusion? Who designed those? Who are they for? How many staff partners have taken them, etc.? There's a lot in this. And I do want to reassure you that we have a number of educational opportunities right now. We've done a number, but we're going to do a lot more as well. And perhaps I'll invite either Irfan Dalla or our Director of Anti-Racism, Equity, and Social Accountability, Allison Needham, to speak to that. Either or.
Do you want to start, Allison, and then I can chime in if you like?
Sure. So thank you for the question. So I guess we can start by saying that maybe about officially on the books, maybe about 200 to 300 people have taken SONYAS that we are aware of. And so SONYAS is an Indigenous cultural safety education program that is in-depth and truly is the industry standard on not only educating, but actually changing actions and behaviors. There's probably another 100 people that are going to be in the next cohort as well. On top of that, we can speak to LNOD, or sort of Leadership and Organizational Development, has done a great job in organizing training for leaders. And so that training has looked like a retreat for leaders last year, as well as 4 sessions that were offered throughout the year and very well attended by our leadership with lots of great feedback. In addition, there's been a lot of localized work as well. So invited speakers, et cetera, that have provided targeted education. And some of this education, for example, has come from groups like 519 or Rainbow Health. So leaders in providing specific types of education. In that particular example, that was around cultural safety and awareness for LGBTQ people. So another thing that I wanted to add, and this is probably another shout out to leadership and organizational development, is offering sessions on microaggressions, which is really important, and looking to continue to offer those sessions broadly. And maybe I'll tap Irfan to kind of finish up with a few other points.
I don't think I have much to add to that comprehensive answer. I guess I will say that we have seen a huge number of programs, departments, groups in the organization take a real and serious interest in this area over the last couple of years. And so there's a lot of sort of bottom-up educational initiatives, if you will. We've seen a lot of reading groups, for example, people bringing in speakers, people bringing in people with lived experience to do training, but huge variety, and certainly an area for increased learning as we go. So thanks very much for that question, and thanks, Allison.
Oh, sorry, one more thing that I would just add, which is another great point, is that every staff member that goes through orientation when they come to the health center does do a piece of education on equity. And so this is part of everyone's entrance into the organization. And this module is continually being looked at, but offers some excellent introductory training on equity to every staff member that comes here.
Thanks tons, Allison and Irfan. We're off to a good start. Lots of work yet to do. So I'm going to stay with the theme of education and also cycle back to patient and family-centered care. And that is a question around how Unity Health is educating staff and leaders to work with patients and families to improve people-centered care. And maybe I'll ask either Kathy or Jennifer to address that.
So certainly, I think if we think back to the activities and information I shared with the previous questions that I responded to, really the input and critical thinking of our patient and family partners pushes our staff and our leaders every day to rethink and reinvent how we provide care and services to ultimately improve the patient experience. And so as we continue to grow our patient and family partner program and further engage and embed patient and family partners in all the work that we do, we'll certainly continue to improve patient and family partnered care and achieve our vision of the best care experience created together.
And I would just add that it's because we do involve patient family caregivers in so many activities that we expose so many of our staff to the processes of involving patients, to listening to patients, and to taking their input into account as they develop programs and make decisions.
Thanks tons, Kathy and Jennifer. So I'm going to take this is another big question, and I'm going to give you a sort of a brief answer to it. And the big question is, in what ways does the strategy achieve Unity Health's mission? Our mission being our raison d'etre. And our mission really has, I would say, really, I'm going to say it has 3 major directions. One is to provide holistic, compassionate, excellent, high quality care to all that we serve. And then we have an academic mission, which is around providing education to future healthcare professionals and to do health research. So I would say that all of the components of our strategy link back to our mission. As I said, our mission and our values are really the foundation of our strategy. So we really do plan and strive to provide top-tier holistic care experiences for all that we serve, recognizing we have a lot to do for all that we serve. And from our origins, it has been part of our mission to serve particularly those who experience disadvantage or marginalization in our society. That continues to be at the heart of who we are. We're also really committed to advancing healthcare through high quality education and research and innovation, as highlighted by some of the details of our research, innovation, and education strategies. And I think another key feature, as I mentioned before, our strength is our people, and so we do all that we can to attract and to sustain really great providers. All of our staff and our physicians, our educators, our researchers. So I think that's kind of the high level answer to that question. I'm going to go now to a question around accessibility. So this is one that's been submitted in the Q&A. When enacted, the Accessible Healthcare Standard will require that Ontario hospitals be accessible. Will the board and the management, I would add here, consider another adjustment of the strategic plan to specifically define goals around accessibility and elimination of barriers? Really great question. Who wants to begin with that? Colleen, do you want to start?
Yeah, why don't I start and then maybe hand it over to Irfan?
Great.
So maybe just to describe to folks the way we embrace the strategic planning process at Unity Health. The vision and the broad strategy for the organization are very enduring, and we're not constantly changing the strategy. But what we do every year, and obviously Tim and his management team come to the board with a very thoughtful proposal on their strategic goals for the coming year. And those goals may change from year to year. So I think the question on accessibility is a very good one, and definitely something that we will consider in our future goal setting as the rules become more clear. And with that, I'll turn it over to Irfan.
Thanks, Colleen, and thanks for the question. Issues related to ability and disability are obviously integrally linked to our focus on equity and taking care of helping provide care to people who need it most. Some folks will know, and others may not, that over the last few years, the provincial government has had a committee looking at healthcare standards related to disability. I guess hopefully it goes without saying that we will meet all standards that the government sets in this area, but we would also strive to go beyond those standards and to, just as we are always striving to be more anti-racist and more equitable, we would also be striving to be less ableist. And so, while it's probably fair to say that anti-Black and anti-Indigenous racism have been greater areas of focus over the last year or so. Issues related to accessibility are also really important to the Council on Anti-Racism, Equity, and Social Accountability, and an area where we also know that we just need to continue to get better and better. And also recognizing that there are a wide range of disabilities, right? So we're not just talking about mobility, but also mental health, vision, hearing, language. It was a really good question that somebody else put into the Q&A related to even the way we have these meetings. And so there's lots for us to learn and to continue to improve. So thanks very much for that question.
My goodness, now the questions are flowing. We've got 9 questions submitted here, and really, I think we only have time for one more. So some of them are similar themes around accessibility and patient and family-centered care. So we will take those questions and certainly consider them. And again, I'll just emphasize that if you haven't had your question answered, you're more than welcome to submit your questions to our communications group. So I'm going to change the theme just to cover, in this last question, just to cover another area. And Dean, this one's coming to you. Give Dean a chance to speak. This question is, I have noticed there are very limited recycling or even non-existent recycling programs through Unity. I'm going to say Unity Health. This actually says St. Mike's. Will the organization be working on implementing recycling bins throughout the network? We need to be conscious of our huge environmental footprint. We create way too much waste as a large healthcare network, and we agree with you. There are a number of green initiatives, but Dean, do you want to tackle this question?
Thank you, Tim. Unity Health has a well-developed recycling program, and the hospital has won several greening awards for our efforts. We have recycling and sorting stations in most of our public areas. We are reviewing your request to increase the number of recycling bins in the organization. We have an active greening committee in place that reviews opportunities to continuously improve with staff and physician representation. We have recently completed another waste audit, and we're going to make those results available to all staff. We all know that COVID has increased our waste footprint. However, we've also made some strides in reducing waste through our reusable gown program. This has now been implemented at all 3 sites. And during our COVID peak utilization, we reduced our disposable gown utilization by 7,000 gowns per day, and the team was really proud of that. We need to do better on our recycling in our inpatient rooms, and we'll work with our greening committee on this. We are focused on our environmental footprint and have more opportunities to reduce wastage and continuously improve. And we would also like to share our metrics with you. Thank you, Tim.
I want to be respectful of your time, and it looks like we have about a minute left. There were some great questions here, and we will endeavor to get answers to those that ask them when we can identify you. But again, in the chat now, Aubrey has entered that if your question wasn't answered today, please send it to communications@unityhealth.to, and we'll certainly be happy to follow up with them. And I really, really want to thank you for your questions and your engagement this afternoon. And with that, I'm going to hand it back to the chair of our board, Colleen, to provide a few closing remarks.
Well, thanks, Tim. That does bring us to the end of our meeting. Boy, this has been a great hour. Thank you so much to our speakers today, and also to everyone who took the time out of your day to learn more about Unity Health Toronto. And thanks for your great questions. We really appreciate it, and we'll definitely get back to you on some of those that weren't answered today. You know, Unity Health is an exceptional organization with fantastic partners, and I truly appreciate all of your hard work and your commitment. Thank you for joining us for our first open board meeting, and feel free to provide us feedback on how we can do it better next year. And we definitely do look forward to seeing you again next year. Thank you again.
All the best, everybody. Thanks tons. Have a good evening.